My name is John Whitman, and I am a faculty member at the Wharton School at the University of Pennsylvania. I teach in the MBA Healthcare Management Program. My specialty is Senior Care Services. I also serve as the executive director of the TREX Institute. It's a nonprofit dedicated to improving care for seniors and reducing costs for our healthcare system. And I'm also a national consultant in healthcare issues, primarily focused on senior care and improving care for seniors. Items have been out there for a while, opportunities have been out there for a while, but have not been well accepted, primarily because of reimbursement limitations. But COVID-19 has changed all that. COVID-19, one of the few good things of COVID-19 is that it has catapulted the use of technology, telemedicine, remote patient monitoring, and others 10, 12 years forward. And that's a wonderful thing in terms of improving care and reducing costs for our healthcare system. One of the big pain points in healthcare right now is readmissions of patients who leave the hospital and go home, or leave the nursing home and go home, or those in the nursing homes that end up going back to the hospital. And there's an opportunity to correct that, address that pain point by combining technology that could be started, for example, in the nursing home, so people while they're there are trained on how to use this technology, and then they take it home with them. And most of this would be remote patient monitoring type devices. Remote patient monitoring is nothing more than an early warning system. So if a patient that has a heart condition, for example, they start going bad, if there's signs of their blood pressure going bad, the doctor gets alerted with enough time to intercede before it turns into a real medical crisis. And the whole goal there is to prevent ER visits and hospitalizations, because they are extremely expensive for our healthcare system, and so many of them are unnecessary. And now with remote patient monitoring, we can catch a lot of that up front before it turns into that crisis. And that's the advantage Inova is bringing to the market right now.
So I've been a physician for over 30 years. I started a teleradiology company a number of years ago, and through that I developed an interest in telemedicine. Telemedicine at the time was at the very beginnings, it's in its infancy. It's grown tremendously over the past decade. The promise of telemedicine is that it provides better communication between doctor and patient. Sometimes that communication breaks down, and when it does, patient care suffers. Remote patient monitoring can actually change that paradigm in a very significant way. When a doctor, instead of seeing a patient once every 6 months, can now see a patient and the results of their blood pressure on a daily basis, it just changes everything. The ability for that physician to now be able to prescribe the correct medication, the correct dose, or make changes whose blood pressure is not well controlled, now have the ability for their blood pressure to be better controlled, and therefore the significant complications that can come with hypertension can become lessened.
I'm Charlie Kokinas from West Palm Beach, Florida. I was recently in an accident and ended up in trauma care at St. Mary's Hospital, which is where I've been for the last 2 weeks. And I've just gotten home, and I've started patient monitoring at home. It's more convenient, it's all in one. It's able to take the readings and store it up in the cloud or somewhere. And that way it's visible, so I can see all the results, or the physician can look at the results, instead of having wires dangling and having to hitch another wire up and download something else. It's much more efficient. You open the box, the devices are in the box. I took the blood pressure out, put the cuff on, charged that, and then I took the pulse oximeter out and put the batteries in that. And everything was ready to go.
That's one advantage that telemedicine brings to the table that didn't exist 5, 10 years ago. But I think that these companies that are coming in to really disrupt healthcare forget about that sacred relationship that exists between the patient and doctor. And if someone has a chronic medical condition, or God forbid, even one that's cancer related or something that's really life-threatening, to get them to change their doctor is really a tall order. So telemedicine maybe has a presence for these disruptor companies for basic, I have a runny nose, or I have a flu symptom. But for people that really need health care, and the rule of thumb that we've always relied on is 20% of the population consume 80% of the healthcare dollar. So if you really want to make an impact, you've got to focus on the 20%. And to have the expectation that that 20% is going to be willing to change their doctor is very unrealistic. So all of our solutions are really designed to help enhance the doctor-patient relationship, and to help that physician by providing them with technology that gives them more frequent contact and more efficient contact with their patient. And I would say that that's one of the key differences between Inova and our competition.